I want to thank you all for being here, for your testimony, and for sharing deeply personal stories. As has been repeated here, and we know to be true, access to reproductive care, the issue of abortion itself, a decision to terminate a pregnancy is deeply, deeply personal. It's complicated, and clearly there are views that Americans have on this issue that present deep and conflicting convictions. And so just the ability, the opportunity to have true discussion and conversation about it, I think, is important. I have been pretty clear where I stand on this issue. I think the choice to have an abortion should ultimately be in the hands of the woman, of the individual, not the government. But I also believe that it's reasonable not to require those who are firmly opposed to abortion to support it with their tax dollars, and that providers who do not wish to be involved in abortion should not be forced to do so. And that's why I've worked with several other colleagues here, Senator Collins, Kane, Sinema, and I have this bipartisan legislation to ensure that the rights that women have relied on for the past 50 some odd years, those that were set out in Roe and in Griswold, are protected. I think that they should be protected. We establish a federal right to choose and reaffirm the right to contraceptive access without raising concerns about religious freedom and provider conscience protections. So my position on this is clear, but I'm also pretty clear-eyed in recognizing that it's unlikely that the Congress is going to pass legislation that would establish clearly that right to abortion, certainly in this Congress. But I will tell you, I continue to hear from so many in my state, women in Alaska, who are concerned about access to abortion, access to reproductive services, even while we are a state where we have included in our state's constitution a right to privacy that protects that access to abortion. But what we have seen from decisions across the country in the lower 48 is a ripple effect that has come all the way up to the north. Planned Parenthood in Soldotna, Alaska location closed in anticipation of the trigger laws that were coming online that would require more resources in other states. So we think that we are far enough away that we're protected, that access is protected, but there are implications that move beyond those state boundaries. And so women are asking me about access. We are a very, very rural state in the first place. Access to providers is limited in the first place, and certainly access to abortion has also been limited. And I'm going to throw this out to anybody on the panel. What can we do practically right now to help ameliorate some of what we are seeing with the impact of the Dobbs decision to ensure that women do have access to the care that they need now? I wasn't here when you presented your testimony, Ms. Anderson, but I can't imagine how difficult when you're already in a very stressful situation, the thought that I might have to travel hundreds of miles, incur extraordinary expenses to travel, but the access to care is so limited. I've I've given you no time to answer, but does anybody have, Ms. Lopez, go ahead.
Yeah, I'm happy to answer. Thank you for the question and for the describing the experience in Alaska. I mean, I think one of the things we can do, Senator, is ensure that we can maintain access to medication abortion, right? Medication abortion now accounts for 2/3 of all abortions in this country as of 2023. And in rural areas like yours, it's incredibly important to have that option via telehealth for folks who can't reach a provider or when they live in communities, as the doctor said, that don't have providers, given the limited access to providers that they have. And so maintaining access to a method that we know is safe and effective based on decades of widespread use and study, I think becomes critically important.
Thank you for saying that. I absolutely agree. Thank you, Mr. Chairman.
Thank you.